Today, I want to talk about thyroid issues. A lot of women have thyroid problems. I had thyroid problems. My daughter has thyroid problems. My mother-in-law has thyroid problems. So I run across a lot of patients that have it. So I just want to share some information just to educate you guys on it. And so when you do go to your doctor and you are, talking to your doctor about it, you can at least have a little bit of general information about it. So you don't feel stupid like I did. So anyway, some facts on hypothyroidism. The thyroid gland it produces two main hormones, T3 and T4. Okay. Now, T3 is the active form. That's the form that every cell needs, and that's what you have to have. T4 is the inactive form. So you need to know that. So when you usually get on medication like levothyroxine, that's T4. You have to be able to convert that to T3. If you can't do that, that's probably why the thyroid medication isn't working. So when I was having thyroid issues, that's what happened to me. We couldn't get my TSH down. And I literally had to go to something like Armor that had T3 and T4. So it had an active and an inactive form. Okay. Anyway, so just trying to let you guys know a little bit about that. So that way, if you do run across your doctor and you're trying medication and it's not working, that could be the reason. So these hormones regulate the body's metabolism. And the most common cause of hypothyroidism in the USA is Hashimoto's. And what is Hashimoto's? Hashimoto's is an autoimmune disease. So again, is it a true thyroid problem or is it an autoimmune disease? And that's what we're going to discuss today. And so what are some of the symptoms of hypothyroidism? Fatigue, cold intolerance, joint and muscle pain. Those are your big ones. If I had to throw one more in there, I would say depression. So anyway, if that looks familiar, you'll know why. So then here we go over hypothyroidism review. So again, we're just giving you some symptoms: fatigue, weight gain, cold intolerance, muscle pain, joint pain, thinning hair, slowed heart rate, depression, and heavy or irregular menstrual cycles. Um, you're not going to have all these, but you're probably going to have at least three or four of these, maybe more. The hallmark for women when I'm looking at women is usually on them, I'm going to notice thinning hair. On a man, you don't notice it as much because just men just don't have, they lose their hair. It's male pattern baldness, not related to the thyroid. But in women, they will have thinning hair. And then you look for depression, weight gain, fatigue, cold intolerance, and like muscle pain. Those are your big ones. So, how many people have thyroid issues in the United States? And I just, looked this up just to let people know hypothyroidism is the most common endocrine disorder of the thyroid gland. It impacts over 30 million Americans. Okay, so that's a lot of people, 30 million Americans, just to give you an idea how many people that affects. And then we want to go into who's at risk for hypothyroidism. Women are usually at risk. It's usually 7 to 1 women at least. They say individuals over 60. That's probably true, but there's a lot of younger women coming in with thyroid issues. I'm seeing them as young as in their 20s now. I think it has to do with what we eat and supplements that we probably don't take and our lifestyle changes, to be honest. So that's a big one, women and older women. But like I said, I'm seeing it in younger women as well. Those with a history of thyroid problems. So if your mother had thyroid issues, just think you're probably going to have it. Get checked, and we're going to talk about blood work and all that, so you know what to look for. Um, Individuals with certain conditions such as type 1 diabetes, rheumatoid arthritis. So you're looking at autoimmune diseases. Again, Hashimoto's is an autoimmune disease. That's the number one cause for hypothyroidism. Okay. And then we got Turner syndrome and we got pregnant women. So you just you have to look at these. I would say, it's going to be women and there's going to usually be a family history and they're going to be more prone to other autoimmune diseases. Um, so the most common causes of Hashimoto's or thyroidism, again, hypothyroidism. Here we go. It's Hashimoto's disease, and it is an autoimmune disorder which attacks the thyroid gland. Okay. So um, you have to understand that's an autoimmune disease. So if it's attacking your thyroid gland, you're going to find these things called TPO antibodies or thyroid globulin antibodies. I'm going to show you what those look like in a lab test later. Thyroiditis is where the swelling and inflammation damage the thyroid cells. You could have iodine deficiency, thyroid surgery, radiation surgery. And here's the other one that I've noticed. A lot of people are coming in with thyroid issues, and it's because of their medication. And we're going to talk about that later. But some of the medications can cause hypothyroidism too. So you need to know that. Um, Here's a thyroid pathway. We're looking at the hypothalamus, and this goes to thyroid releasing hormone, which goes to the pituitary, which goes to the thyroid stimulating hormone. Now, when the thyroid stimulating hormone, when you're making your active T3 and T4, T3 is active, T4 is not, you realize you're not making much of it as T3, only 7% roughly. It has to go to the liver and the gut to be converted to the rest. So if you have liver detoxification problems or gut problems, you're still not going to get enough thyroid, okay? That's where you're going to have to up your medication. And those with gut issues typically have thyroid issues. It goes back and forth between those two. So I just want to let you guys know that this is the pathway. And so the liver and the gut are critical for thyroid health. So they typically will have gut issues. Um, Now, here's a test that we look at. If you're going to run a full thyroid panel, this is what they call a full thyroid panel right here, full thyroid panel. They're going to look at T3 and T4, free T3, free T4. But here's the main ones. You really need to look at the TSH, and the big ones for Hashimoto's thyroid or an autoimmune disease, Hashimoto's, is um, thyroid antibodies, the peroxidase antibodies, and thyroid globulin antibodies. These right here. And these, I will just tell you, hardly ever get checked. Okay. Now, if these are high, you can bet we're going to have a thyroid problem. Okay. That's Hashimoto's. A lot of patients I see will have a high TSH, say it's around 7 or 8, and they'll be put on thyroid medication, and they'll never be told that there's an autoimmune disease. And they looked at their TPO antibodies maybe one time and never looked at it again. You need to have these tested. This number should be low. They're saying 34. I like it. I like it 0. But um, when I had mine tested, they were 1200. So they were really high, and it took them years to figure it out. Okay. And a lot of medications later, because they put me on medications before we even got to the thyroid. So I'm trying to save people on this, because you're going to have brain fog, you're going to be depressed, you're going to be gaining weight, you're not going to be able to lose it, you're going to be irritable, moody, you're going to have the joint pain. All those things are going to happen if your thyroid's off. And here's what I'm going to tell you is, on this, the TPO antibodies and the thyroid globulin antibodies, those are going to go off probably years before the TSH goes off. Okay. So you have to know that. And then when the TSH goes off, these have been off for years, and now you have an autoimmune disease. Okay. So keep that in mind. Um, one of the sources, one of the things out there they say is gluten can cause it. Now, I'm sure a lot of people heard about this, but gluten's a little more tricky than what people think. But gluten may cause problems with people with Hashimoto's disease, even if they do not have celiac. And that was my case. I had to go on a gluten-free diet. So gluten has been found to contain proteins that interact with thyroid antigens, and if included in your diet, your Hashimoto's symptoms may worsen, or at a minimum, not get better. Okay. And the reason is, this is because the protein structure of gluten is similar to the structure of the thyroid. And when some people with Hashimoto's thyroiditis, they eat gluten, the antibodies attack the thyroid, because they look at it like the gluten looks like the thyroid. Okay. That's where it gets to be a problem. Okay. Now, most traditional doctors are not going to talk about this. I have friends in the medical field that still to this day do not believe in this, but if you are around in functional medicine circles, this is what is talked about. And so when I do that, there's only one thing, is to test for gluten. Now, this is gliadin, this is gluten. Okay. There are several types. It's not like there's just one type. There's alpha gliadin, there's alpha beta gliadin, gamma gliadin, omega gliadin, there's gluteomorphin, and prodynorphin. These are just gluten. I'm not even getting into the other ones, guys. These are just gluten. And there's other forms of gluten, but gliadin is gluten. And so when I go online on Facebook and I see all these people, saying, well, what's the best gluten-free food? You have to understand, it's more than just gluten. There, it's also other wheats, and then it here again, it's also other grains. So when someone goes gluten-free, they're still going to probably have quinoa, rice, sorghum, teff, oats, barley, rye, and buckwheat. But these act just like gluten. So you really have to look at all the grains. It took me years to figure this out with patients. I made a lot of mistakes before I figured it out, but I guess I didn't figure it out. I just listened to guys who had already figured it out and took their advice and started implementing it with my patients. And that's why, I had several patients that just, for instance, like I had a patient like this and they were not getting better. Well, they're eating quinoa and rice because that's gluten free and they're not getting better. So when they come back to you and they say, "Hey, I'm on a gluten free diet and I'm not feeling better," that's because it's going to be something like this. Okay. Oats are a big one I see with people. Um, Sorghum too, and usually rice and quinoa because there's a lot of things out there that are gluten free that have rice, rice that's gluten free. So, anyway, that's why you've got to really get with a functional medicine practitioner that knows what they're doing because you could try these diets forever and you won't get it right unless you know exactly what it is. Okay. And let's just say on this one here, quinoa, it's not just quinoa, it's quinoa, but look, it's albumin, it's the legumin, it's bromelain. It's all these. It's not in rice, it's glutenin, alpha globulin. It's all these. It's certain types of those. So there's more than one type of quinoa, certain proteins in quinoa. These are just the ones they tested positive for. So if this person continued to eat quinoa or rice, they're still going to feel like they're eating gluten. And that's what a lot of people don't know. So anyway, and then, you have to know what to supplement for with the thyroid. And one of the things that I supplement for with them is we have this advanced thyroid support. And so it has some things in it like B12, iodine, magnesium, zinc, manganese, selenium, and so on. But these are really good for the thyroid. This is a really good product for the thyroid. People tend to take this. It tends to help them able to lower their medication or possibly get off their medication because now you're supplementing for the thyroid. Now you're giving the thyroid what it needs. And there's other things too, like vitamin D, and we can go into that, and then the omegas. But I'm trying to keep it simple right here and just talk about one product today, but this will help with their tiredness and sluggishness. And it's going to help with their diet. They're not going to be as hungry. It's going to, when you have thyroid problems and you're hypothyroid, you tend to be hungry more and you tend to gain weight and it's harder to lose and you're tired. So that's like a deadly combination. Because when I had the thyroid issues, I wasn't motivated. I was depressed. I gained weight. And I never had any GI issues. So some people will have GI issues, some people won't. Some people eat gluten and it just wrecks their system. Other people, it doesn't. So if you really want a thorough evaluation, I can do that for you. I do offer these for free right now, but this is what I like to do. I like to treat the thyroid, and usually you're going to see Hashimoto's, and most of these patients have been on medication. If you're on thyroid medication, you probably have Hashimoto's, and you really need to get to the root cause of it. What will eventually happen is you'll just keep going on more and more medication, whether it's for depression, anxiety, proton pump inhibitors, or things like for your gut, pain medication, whatever, NSAIDs, steroids. And the main thing is you don't want this autoimmune disease to lead to another autoimmune disease. So that's what kind of scared me and made me realize that I need to do that. Okay. Anyway, um, I hope this information was helpful. And if anyone is interested in signing up for a health assessment, we go over this in detail and I look at their labs. My main goal is just to try to educate you guys on this because when I'm out online looking at these Facebook groups with Hashimoto's groups or a gluten group, it just seems, they're not really getting the details of it. And so I like to shed some light on that because I've had years of experience in this and I've treated hundreds of patients and I feel pretty successful with handling a Hashimoto's case. Anyway, if you guys are interested, just reach out and we'll do a health assessment. And again, when you go to your doctor, here's what I want you to look for in the blood work. Where is it? Let's find it right here. You need these. Take a screenshot of these. And the main ones are you want that thyroid antibody, the thyroid peroxidase antibody, and the thyroid globulin antibody. These will go out of whack most of the time before the TSH does. Okay. And then when the TSH goes out of whack, that's when they put you on medication. They can bring that TSH down to normal. But if these are off, you're just never going to feel right like I did. Okay. Anyway, I hope this was helpful and we'll bring you some more next week. Okay, guys, have a good one.